You're all very welcome. Thank you for joining this session of DHCNI Digital Dispatches, which is part of our approach to try and find ways of communicating a little bit about what we're about, what we're doing, what our priorities are, and to engage with people across the system in that work. These sessions are normally introduced by the Chief Digital Information Officer, Dan West, but unfortunately, Dan's not able to be with us just now. He may actually be able to join during the course of the session, and we shall wait and see. So for now, you've got me, Eddie Ritson, and my colleague Soo Hun, and you've got us because we're the people in Dan's digital leadership team who are charged with taking forward work on digital innovation. Many of you will hopefully have been aware of and maybe engaged in work that we've been doing recently on developing a new digital strategy for the HSC. And as part of that, we're developing further strategies on data, on cyber, and on innovation. And we're doing some work, and we'll be doing some work over the next couple of months to bring those areas together, and there'll be opportunity for people to input to that process. If Dan were here, he would challenge us a little bit about the often held view that innovation equals something good. He would remind us that lots of innovations distributed across the health and social care landscape do not always equal or lead to systemic transformation, which either improves the health and well-being of our population or which leads to a more economically sustainable, high-quality health and care system. The challenge, I think many of us would recognise, is to find means of enabling, identifying and harnessing those particular innovations or changes which are capable of scaled application and significant impact. I'm sure that many of us can think of good ideas that have failed, maybe some of which have worked elsewhere. I'm sure many of us can think about some problems that are looking for solutions, or solutions that are looking for funding, or ideas that are looking for support. And in today's presentation, Soo's going to take a little bit of time through a short presentation to describe why we think innovation and digital innovation is important, what our vision for that might be, and how we might find a way of organising ourselves and resourcing ourselves in a better way to promote and enable digital innovation across the health and care system. So we welcome your attendance and your participation today.
Good afternoon, everyone. Thank you very much again for the opportunity to come and speak to you a little bit about the digital innovation strategy, which has been in the works for about the guts of 9 months, I think, over COVID and before pre-COVID as well. So I'm going to just share my screen, and again, I'm going to then play a video very quickly. So my name is Soo Hun. I work within the DHCNI team, and as you can see, hang on, let me just presentation mode. Yeah, as you can see, I work for the digital health and care team. My role is really to lead on innovation and a digital ecosystem. And again, hopefully through the course of the strategy, you'll be able to understand what these two areas mean to us. So just very quickly before we start into my talk, I think I'll just play a very quick video here that hopefully you'll be able to hear.
Story about COVID-19. The crisis is boosting innovation with the emergence of brand new ideas.
mRNA vaccine, a new technology.
And with the application of existing ones in surprising new ways.
The crisis has caused an acceleration in adoption of technologies.
This is pushing the world further into the future.
We've had to build more airplanes than we ever have before.
Often at breakneck speed.
We just closed £350 million.
Businesses are being forced to adapt.
Hello. Oh, thank you. Amazing.
Or face extinction.
Another hammer blow to Britain's retail sector.
This upsurge in innovation will bring lasting change for good and bad.
Could you get into your computer? This is my kid's future.
So what lessons can be learned as the world looks towards the post-pandemic era?
There is an opportunity for innovation to stay at the cutting edge.
I haven't seen this. Is this a new piece? What is this part?
The front of the fuse.
Got it.
This is the headquarters of Zipline, a drone manufacturing company.
This is 3D printed?
Yeah.
Oh, this is plastic now, yeah. Oh, yeah, totally.
Since the pandemic, the business has really taken off. Drone technology has been around for a while. But during the pandemic, it's starting to realize its considerable potential. With social distancing the new normal, health systems around the world are now looking at drones as a new and better way to deliver products, such as blood, cancer treatments, and vaccines.
Every hospital system and health system on Earth is suddenly trying to reconfigure itself to a new reality, to extend the reach of the hospital system directly into the home, enabling care closer to where patients live, so they have to travel less, it's more convenient, and the patient takes less risk of getting infected if they need to access general care.
From mid-June to September 2020, Zipline delivered more than 100,000 medical products, as many as over the previous 3 years.
And we've done a few things. The center wing covers are now.
When did that change?
Weeks ago.
Perhaps the most significant change has come in countries with strict airspace laws. In May 2020, an emergency license was issued in America, allowing Zipline to fly long-range delivery drones through controlled airspace for the first time. And in December, American regulators issued new rules, allowing drones to fly over people and at night. This looser approach is accelerating the shift towards more states receiving medical supplies in a more efficient and productive way.
So we're seeing hospital systems that previously thought they had 10 years to effect this kind of change, now trying to do this in 1 year.
Although drone-filled skies are some way off, COVID-19 has also accelerated the conversation around the use of drones beyond healthcare in a variety of new fields.
So I'll pop this out.
Zipline has partnered with retail giant Walmart. It's one of a number of companies due to begin trial deliveries of consumer products.
I think it's been really easy for people to understand the value, and there's a pretty intense sense of civic pride around the country leading the way in terms of showing how this new technology can save lives.
This kind of rapid adoption of emerging technologies has been called tech-acceleration. And it's the type of innovation that has been given the biggest boost around the world by the pandemic.
A classic example of tech acceleration was what happened in the National Health Service in England, where a system to make possible video calling was effectively built over a weekend and then rolled out to doctors across the country.
Tech acceleration is pushing companies further and faster into the future.
Exactly how many years into the future we've been pushed by this crisis varies. It depends on the behaviour, it depends on the country, but it does seem to be sort of the order of 5 years. So welcome to 2025.
History shows that innovation often thrives during times of crisis. Take the financial crash of 2008, which led to the widespread adoption of cloud computing. The cloud had been around since the early 2000s, but it gained a new footing as the economic slowdown took hold.
Companies were very often reluctant to try cloud computing. They thought it wasn't secure, and then they gave it a try, found it was cheaper, found it was more secure, and cloud computing has expanded very rapidly.
As well as accelerating the adoption of developing technologies, crises can also foster the development of entirely new ideas.
A good example of a crisis that led to lots of invention would be the Second World War. So you get the first digital computers, which are used for code breaking. You get the first jet engines. That paves the way for mass air travel. You get nuclear technology, which is used for weapons, but can also be used to generate energy. And you also get the first rockets.
That's it.
When it comes to new ideas, COVID-19 has left its mark in the field of medicine, where researchers around the world have pioneered new techniques in the development of vaccines.
This phenomenal work has been done, multiple teams producing vaccines in months rather than years, using entirely new technologies in some cases. So these mRNA vaccines are a new type of vaccine, and they seem to work extremely well. So that's a very impressive example of invention.
We are collectively telling cafes, pubs, bars and restaurants to close.
In most industries, the pandemic has boosted innovation by forcing companies to adopt new ways of doing things, purely as a matter of survival.
We have innovated.
I'm going to stop there because the rest of the video, actually, if you're interested, I'll share the link, but the rest of the video deals with obviously outside of healthcare. But I thought that was a good video to kind of set the scene for kind of what the future is like, can be for us, and what the future has been. Actually, for us, we have embraced cloud computing, for example, that's referenced. That was something that, again, was something maybe have been talked about, and the ICT colleagues that are here will obviously appreciate, those early conversations. But we are now using cloud computing, so that's an example of where we ourselves have been affected by those innovation. But bringing you back to where we are in terms of the innovation strategy. Let me just share the screen again for the slides now. And as you can see from the actual video earlier, this whole COVID has been driving innovation, resulting in tech acceleration, which is the rapid adoption of emerging technologies. Within health and social care, Northern Ireland, there's the increased ask for digital health and care Northern Ireland for digital tools and data. And again, Claire will be able to tell you, and Eddie will be able to tell you all the work that they've done to push the test, track and trace, the COVID vaccination, mainly all on digital platforms. So we've been able to harness digital to enable and support innovation during COVID. And we've also been able to use digital to drive innovation during COVID. So the purpose really of the digital innovation strategy is really simple. It's really to tell everybody, if you're not really aware yet, that innovation in digital products, services, and processes is actually really important to HSC. We want to be able to put in place processes and structures through which a HSC may best well support and enable digital innovation, to attract resources in collaboration, which we know were critical and vital during the whole pandemic, with which to develop necessary processes and structure. And we want to maximize the innovation that we've developed during COVID in order through the use of digital technologies and data. Pre-pandemic, again, going back to our other strategies, there already was within the Health and Wellbeing 2026 Delivering Together strategy, was already references to wanting to work with innovation or harnessing innovation. So you see, we've references about teams being able to keep pace with innovation, the fact that we should be actually more focused on outcomes of patient rather than buildings. We want to work, the ambition to work with world-class universities to grow our life and health sciences, to create jobs, which means that HSC must play its role to provide center of expertise and excellence, so that we work across collaboration within HSC, academia and industry. And then again, we want to be able to achieve a world-class health and social care system. So that's the general ambition. I think the reason for the digital innovation strategy would be to try and meet that ambition. So what's our vision? We don't have really lofty vision. We just want to be able to place HSDNI as a place that excels at encouraging and harnessing the digital innovation in order to improve the delivery of services and the health and well-being of the population of Northern Ireland. So that's really our vision. The reason being that this strategy is actually the first that we've ever done for digital health and care. It is meant to last for 3 years. And in essence, what we want to do is to really build a foundation for what to come. We don't really have a lot of building blocks that we have had in place for digital innovation. We haven't got other infrastructure like the NHS improvement, like the academic health and science networks, or any of the accelerated access collaboration that NHS England and other parts of the UK have. So we don't have the necessary infrastructure to provide the necessary wraparound and resources for innovation. So our priority really is to build the foundation and put in place the foundation block for an environment that offers innovation, resources, processes, and a culture that is conducive to meet the vision and achieve the desired transformation activities. We will put in place regular reviews, but we think the next 18 to 36 months will be allowing us to put in place some initial projects to test this infrastructure. So that's why it's not a very lofty ambition, because we want to actually put in the building blocks. And to achieve that, we work with objectives. We have identified five key objectives. So the first objective is we want to really provide support through the digital. We want to develop a coherent approach and alignment. We know that there are lots of people who are already working in the innovation space. So we want to develop a coherent approach and alignment between all the different digital innovation activities and partners, with a focus on digital being an enabler or driver for innovation. We want to also identify strategic themes. We want to be able to focus digital activities which are aligned to the HSE, the wider DHCNI vision and strategy, including transformation and policy agenda. Another very key important piece, and Dan, if he was here, would stress that repeatedly, we want to actually, having identified those key themes, we want to actually identify those good innovation that has already been tried and tested, but provide the adequate support and resources to allow them to actually be successfully scaled and spread. We'll focus on the health innovation that have been successfully tested, and we want them to be able to be scaled and spread. And that's one of the things that we have not been doing successfully. And then the last two are really allowing us to look more external, which is actually, again, one of the things that we often hear from our partners is that we don't really have a common approach to engage with them, whether it's academia, whether it's industry, whether it's a sector. Depending on who you speak to, even within the digital world, there are different approaches. So we want to try and develop a common approach for DHCNI to engage with external stakeholders within the digital ecosystem. And last but not least, we know that we can't stand still. If the digital strategies, innovation strategies for 3 years, then we want to be able to put in place some mechanism to be able to enable the horizon scan for new and emerging digital solutions. And as we can see, we are, from the video clip earlier, we are almost ahead now of the curve, where a lot of things are actually moving so fast that if we don't put in place some of these things, what will happen in the next 3-6 years, we will not be able to harness those opportunities. So I'm going to now go a little bit more detail into each of the objectives. So the objective for number one, which is again supporting through digital, the purpose really, for that alignment as well, is to reduce any of the duplication that overlap currently exists, and it's to enable us to further develop our strength and maximize on the opportunities, rather than everybody doing their bits of it and not talking to each other, which we all know happens all the time in our area of work, and digital is not exclusive to that. So to that end, we have set up a digital innovation steering group. Again, I'll give a bit more detail in the next slide. We're also going to work on a digital innovation pathway. Again, I'll elaborate on that later. And all that hopefully will be supported by a digital innovation support hub. So this is the current, the digital innovation steering group has already been set up and brought together. The initial membership in the inner circle are, as you see, the key kind of innovators within the HSE system, including QI, who are looking at all sorts of improvement, R&D, the ICPs, who are obviously doing a lot of improvement and innovation within pathways, BSO within the ITS, within PALS, within the SBRI, the Small Business Research Institute initiative, sorry, and then CITRIC and NOIC. And there probably will be more as we develop this further from an internal perspective. And then we see then when we have actually got our strategies all lined up and we're all singing up the same hymn sheet, we've got some of the infrastructure already in place, then we see it including all our external stakeholders as well, which would be academia, HIRANI, the Health Innovation Research Alliance, which is our life and science kind of initiative, patients and users, very key, the third sector, industries and SMEs, and any other, stakeholders, alliance or organization bodies that are actually looking at innovation per se. So this is the kind of intention for the future, to include external stakeholders. Next, I'll talk about the innovation pathway later on and focus it in a bit more detail in the infrastructure. We also want to then, second objective, which is actually to focus on our key themes. We feel that in a lot of times, sometimes some of the innovation that we've put in, that has been initiated, they don't actually scale, partly because they're not maybe in the right areas, or not to say not in the right areas, but they're not in the areas that actually matter a lot to the key policymakers. So they might be quite niche, nice initiatives, but actually doesn't actually create a lot of impact. So we want to engender buy-in and sign off for key policymakers, as well as to provide a clear line of sight back to DHCNI goals and priorities. So we feel that if we identify some of these key priorities and themes, we should be able to then allow these innovations to actually have impact on the key areas that actually keep us awake at night. And in order to do so, we also want to be able to look at other priorities and be able to, again, plan a funding mechanism to actually lay the foundation so that when other themes and priorities come on board, we've lined up opportunities that we can actually tap into to meet those emerging priorities. So some of the priorities that we've looked at emerging, again, these are just from internal discussion within the Digital Innovation Steering Group, are optimizing virtual care for long-term condition, obviously waiting lists, and things like mental health. Again, from a technology perspective, there are lots of opportunities from leveraging on AI and machine learning, acute care at home, some of the intermediate care work, urgent and emergency care, and then obviously any of the emerging COVID innovations. Now, we are going to be looking to speak to the wider population and the wider HSC staff to kind of look at whether we've got any other priorities that we have not identified. Should we, what else to be included? Who should actually help us to agree and sign off on these priorities? So again, this is an area that it's still emerging and developing. The third objective is really for scale and spread. And we want to be able to, again, enable pilots that have been impactful to benefit more people, and then foster the policy and program for innovation on a more sustainable basis. So we are going to look at a number of scale-up methodologies or good practices. We are going to try and put in place an innovation architecture that will actually support spread and scale. So we'll look at all the barriers to spread and scale. And then we'll try and also, that another area that we're going to try and do within the whole spread and scale is look at consolidating a number of the COVID-19 innovations and looking to see whether are there any of those that we can actually potentially, again, scale, sustain, and mainstream into some of our current existing services. So when I talk about the digital innovation infrastructure, really, like everything else, we are looking at various tools that we might be able to support the innovation infrastructure. So we're looking at, for example, a repository of good practices. So what are the repository of good practices? There will be things that emerge from research, any good prototypes, any pathfinders, any ideas, things that have actually been proven to work. And then we'll actually benchmark that against or match that against some of the key priorities And if there are any gaps, then we'll obviously use the priorities to look for through SBRI, to other initiatives or funding of the avenues to look for to develop, borrow, steal with pride, other initiatives, best practices elsewhere. We also feel that we need a pathway to help us identify, assess, and signpost, and then deliver those actual initiatives that actually come to us. Again, further slides will give you more details on that. And then on top of that, the kind of from a culture perspective, we think that people are also innovating. Some of them are innovating in isolation. Some people are not aware of all the good practices. So we want to actually do more activities. We want to do joint workings, joint workshops with industry. We want to be able to bring knowledge to the fore. We want to run various webinars, hackathons. So the communication channels and the program of activities and events will be something that will be further developed. Then in terms of the resources, obviously, we will need networks. We will need to build the relationship within the ecosystem. So again, those are the key people that we've identified that should may form part of the Digital Innovation Steering Group. We'll need to skill people up in capabilities from digital to actually how innovation, research, train them up. We need to also be able to enable people to have time and opportunities to engage in innovation activities. And last but not least, obviously funding, which is obviously very, very key to meet this agenda. So those first three are really kind of helping us to more towards the digital innovation, more towards building the capacity, more towards building up the infrastructure. And the next two, 4 and 5, are really ones that are allowing us to engage with external stakeholders, the digital ecosystem as we speak. And the reason for that is, again, we want to be able to build, get value and extract learning from the relationship across the digital ecosystem. We want to be able to get partnerships that are mutually beneficial, but we also want to be able to leverage on any of the emerging global UK, Northern Ireland, UK, EU, and global funding. And again, some of the fundings that through the work that we've done initially has been the Belfast City deal, and there's been been some collaboration between ourselves and Belfast City Council to look at opportunities that emerge from the various city deals, the Dairy City deals as well. And then there's all the Peace Plus funding. There is also, which is the cross-border funding, North and South, but European funding that's for health is about 90 million euros. So that's a big pot of money to enable us to look into innovating good practices and spreading good practices across the whole of Northern Ireland. And then there's Horizon Europe. So there's lots of innovative funding that we should actually be looking into and to support and complement our strategic aims. So again, the plan will obviously identify the stakeholders we need to engage and then plan the activities. And that may include even for organizations like I did academia to kind of develop MOUs with them to make sure that if they're bidding for funding and they need a health partner, we should be there to support them. So this is kind of the landscape. As you can see, the internal ones are us trying to join up all the various innovative nodes within our health and social care system. And again, the stakeholders externally are industry networks, DHCNI, government, housing, community voluntary sector, and our academia and other collaborative networks. So again, these are things that we would hope to be able to identify and put more activities towards. And the last one, as you said, is the scanning for future, again, so that we can stay abreast of developments locally, both nationally and internationally. And you can see, through COVID, we've already been able to access some of the innovation on a UK-wide basis because we've been working more collaborative across the 4 nations. But again, at an international level, there are opportunities to collaborate further. So we need to be able to look at what emerging digital solutions and opportunities that arise. So those are the 5 objectives that we're really hoping to target within the digital innovation strategy. And really the building blocks are the ones that I've highlighted in kind of brown there, the digital innovation group, the ecosystem plan, the hub, the innovation infrastructure, the repository of good practices so that we know where to go and look for these good digital practices if we want to, so that we don't actually repeat and duplicate, and then the innovation pathway. So I'll now focus a little bit more into the digital innovation pathway to kind of reflect what I actually mean. So this is an example of an innovation pathway that's been developed for NHS improvement, developed by, I think, Deloitte. So what it does is really kind of tries to break down the whole innovation into different parts of the process. So the top one is really about creation and idea generation, idea generation, identify of needs. The next stage is obviously developing those, product development, product testing, proof of concept, any of the clinical evidence development. And if it requires further testing, then it goes on to be further tested. But if it is ready to be used, then what are the regulations? So there's a regulation component for it to be used. What is the regulatory approval? What is the route to reimbursement? And then if there's any, well, we don't probably need this national endorsement, but we need to see whether we're at a Northern Ireland level. Perhaps we might need to do some impact evaluation to look at how well it can be used within the Northern Ireland context. And then really focusing on commissioning and adoption, which is the scale, spread, embed, mainstreaming, all those good things. And again, looking at how we commission, looking at commissioning routes, how do we actually find other ways of funding, and then how do we support local adoption? And then perhaps again, once it's been locally adopted, then improvement comes in, so it goes up again for further development. And so the cycle continues. So this is something that we, within the digital health and care, we don't actually have something in existence, and it'd be very useful for us to be able to funnel that, decide which are the ones where each of the innovation that comes to us, at which level, and be able to advise them what they need as they go through the whole process from idea generation to actually being adopted at the local level. We did some initial mapping work where we, again, as you can see, some of the stages are there, where with our digital innovation steering group partners, we tried to ask them to indicate to us where they feel themselves are positioned at within the whole pathway process. So F stands for fully and P stands for partial. And in some cases, so in HSC R&D, for example, they do obviously very much involved in the idea generation, but they're less on the value proposition. Whereas with MOIC, for example, they do support both the idea generation and the value proposition. So as you can see across here, all the various partners, we've tried to map across what the initiatives and where their strengths are and what their value propositions are. And then within the development stage, who will support the proof of concept, prototype testing, and again, you'll see the lots of F and Ps in this particular area. In terms of the regulation, now you'll be able to see, again, I don't think we actually have any organization that actually does the digital assessment and governance, and maybe that is a gap that DHCNI or one of the other organizations needs to be looking into. And digital tech assessment and governance for me includes clinical safety, interoperability, information governance, usability, and accessibility. That's where I think at the moment where it needs to kind of sit before it actually would go into this whole commission and adoption. And if you see again in this, you will see that this is a far more busier domain that people are working in terms of the innovators, but actually in terms of scaling and spreading, there aren't actually that many who are actually very active in this area. So that's why I think with the creation of the digital digital innovation support hub, we probably would like to, through the the digital the hub, to be able to address some of the gaps that we identify here, which is all the business case and commissioning, looking at health economics and the budget impact, looking at actual implementing scale-up methodologies and pathway change. Because again, PALS may do that from a procurement perspective. QI does it from a QI initiative, and the trust do it. But again, from other areas, we don't seem to have a huge number of organizations, and that may explain some of the deficiency that we currently see within scale and spreading, perhaps. And then outcomes and benefit realization. Again, that's not an area that we have many innovators who are involved in. And that's where we see ourselves within DHCNI and the innovation to be able to work through some of those. And again, those will continue to be developed as we go forward. So I know that within that very comprehensive list of objectives, we still have gaps, and there are we haven't included within the strategy some of the what are the innovation potential, the digital innovation potential that we could harness out of Encompass. We know that there'll be lots of data that we collected. We know that it's going to really improve our workflow. How will digital innovation be supported through those workflows, through the ability to test out new workflows, to be able to remap workflows quickly. So how do we harness the ability between the data and some of the opportunities within Encompass to kind of improve on innovation? The other area is personal and public involvement. And I've said we are looking at including a PPI component, but what does that look like? Should we just involve people? You know, to what level of involvement and consultation, in what manner should we involve the citizens and public into the actual innovation itself? Because they're probably quite interested, but how do we actually harness their ideas and their thinking? And then there are obviously opportunities to do touch points or collaboration even within other strategies who, when they look at our innovation strategies, feel that some of the issues that we've highlighted in terms of scale and spread, the lack of a pathway, may actually be relevant for their areas of work. So we're looking to actually touch points with HSCQI, who are about to launch a strategy. We're having conversation with HSC R&D because they also have their strategy, and they see some various areas that we can actually collaborate on, and the wider transformation agenda. How do we actually use the innovation to kind of the strategy to touch upon some of the other transformation agenda and other strategies? And that kind of more or less ends my talk. I'm sorry if I've gone a bit too quick for you, but hopefully that's given you a flavor of the various aspects of the digital innovation strategy.
That's great, Sue. Thank you very much. And I don't think it was too quick. I think it was just enough time for people to finish their soup and sandwiches or whatever they've been enjoying. And we'd welcome any questions or points of discussion. I see that Catherine McCluskey has put something in the chat in relation to challenges with scale and spread, which is a question I posed more to everybody than to you, Sue. And Catherine is querying about capacity. I'm not quite sure, Catherine, what capacity in particular you mean. You may be thinking about capacity just because everyone's so flat out and don't have the time to think, or perhaps you're thinking of some other aspect of capacity. You may want to expand upon that. And funding.
Thanks, Eddie.
Go ahead.
I think definitely capacity, you know, it's been one thing after another for a while, but usually with budget cuts, you know, there's hardly time to do the day job, never mind think about taking on any innovation or even thinking about being part of adopting some new innovation. But, you know, I'm working in Encompass. We're very lucky that we've got people with the vision to fund us. But even so, there are still pockets of our audience throughout HSCNI who haven't heard much about Encompass or are thinking we'll deal with it when it comes. So, you know, it's definitely coming, it's inevitable. So you would think that people would get engaged as early as possible to be as ready for that as possible. And then the other area is IT literacy. I think a lot of people aren't too IT literate, so can't comprehend innovation and how it'll impact on their areas.
And in that regard, Catherine, were you thinking about people within our system as well as people outside of our system?
No, definitely. Well, I've worked outside of the NHS and I've worked in the NHS in England as well as here. But yeah, it's if people don't need to change, a lot of people don't. And, you know, even very basic IT skills can be lacking in areas or else just not applied because people have always done it a certain way and have been very paper-based. So they stick to it until they absolutely have to change.
Indeed, indeed. Louise, you have your hand up.
Yeah, thanks very much. Thanks, Eddie, and thanks, Sue. Thanks for doing this to start with. It's very, very welcome. The video is great because it makes you think much, much broader. I think it might be helpful to have a definition. You know, as the video is running, I thought, what's the definition of digital? Because there's everything in there, you know, from drones to, and I think there's always a risk in our system, Eddie, of it's something that Eddie and Dan West and all do, and it's something to do with computers, doesn't really, you know, affect us. Whereas innovation can be anything, you know. So yeah, there's an emphasis in you know, in my training, the first thing you learn is 70% of your cost is staff. So very, very valuable resource, takes a long time to train. We have a myriad of problems. We should be absolutely identifying anything which enables doctors, nurses, social workers to do their job better. Picking up on Catherine's point there, of adoption of new things. I think this is something for us, Eddie, Sue and Dan and so on to bear in mind. Everybody is so busy that if it doesn't work first time and it's not easily accessed, people are not going to do it, you know, and risk issues and all that sort of thing. They're going to hang on to the system that they have because they know it works, might not be great, but so that should be front and center. So, I mean, my takeaway from this, I'm drafting the email to you. So I have a few things. It's not really a question, Eddie. It's more, you know, I think the fact that we have a focus, what you're doing here is creating a focus. So I have an idea, I've heard about something, I can at least go to Sue and tell her that, you know, there's something brewing over here, or do you know more about X or Y? So in my world, no more silos, everybody's talking about it. That is trying to solve a very real chronic problem of pressure on ED and all of that. Is there anything in the innovation world? People will embrace you, you know, with both arms, if there's anything that will ease that problem and congestion and so on. And these things can be really basic. You mentioned, Sue, the city deals. So I'm involved with, you know, it's around a GP surgery in Cookstown, and the minister wants innovation, you know, digital something. Nobody's quite sure, but that's okay.
Yeah.
And I'm going to say, Sue, talk to Sue, you know, yeah. connect you, and I'm going to connect you with No More Silos as well, Margaret O'Brien and Owen Ferry. And very, you know, as I was saying, these things can be simple. One of the things we're doing now about general practice is, I don't want to be hearing on the radio every day or having questions from MLAs. People can't get through to their GP. We're investing in telephony, and this is the skills thing as well that Catherine mentioned. Either they have great, you know, digital systems, or they don't. But sometimes they have them and they don't have the skills or the people. So there's a whole spectrum of things in there, that the equipment is there, the technology is available.
You maximize those technology itself to reach the place that needs to be reached.
Yeah, so it's that combination of the innovation and the people, and it will certainly ease the congestion and the pressure, and again will be welcomed. Whereas, you know, it's much easier to invest in the technology than it is to create more and more GPs or nurses or all the practice teams. That's much more difficult to do, and their jobs are so frustrating at the moment, you know, and everybody's frustrated. Whereas the innovation, if we just brought these things together, and that's, I think, what you're trying to do here, Eddie. So it's all very, very welcome.
Yeah, I think, you know, the capacity point, like we all recognize that just trying to find time to think slightly outside the box at the minute is quite difficult for people, and the virtual way of working probably hasn't helped. So we're trying to we're trying to put our heads up a little bit and encourage people.
At least I know I can ring Sue. Here's my problem. Have you got anything out there, or anybody who might, you know, we
could then use that to lever a conversation with the necessary
exactly. So there is a thing knocking around. yeah, there's a thing knocking around, an AI thing about waiting lists. Cork, you know, I'll send you the people. So I don't know if we're looking into that even, you know, there's a few things. Yep, let's look exactly.
Thank you. Eilish, you've got your hand up as well.
Yeah, I mean, love what's happening here, but you know, all digital information starts with the first step, as Confucius says, and that is the patient identity. And, you know,
Yeah, I lost your volume there, Eilish. All digital innovation starts with, go again.
But what we haven't got there is that, as nothing else, COVID has shown us that we're still working in silos. Everybody has their own version of who that patient is. And in order to be able to make the best use of interoperability, standards and consistency of the identity of the patient is essential. So we need a regional strategy to help deal with that. One thing the patients don't know, they don't know they have a health service identity, and to try and use that consistently. So we need to sort of start looking at that. That's the basics. Digital identity service is a good foundation, but that's a system. It needs protocols and business and guidelines, accountability of the identity in order to make it happen, and definitely to involve the patient. It's a partnership between the patient and the health service.
Well, speaking on behalf of my friend and colleague Claire, who has probably done the biggest digital public-facing service on vaccinations, I think you probably rapidly agree, Claire, that if everyone had known and utilised their health and care number in the vaccination booking process, your world would be a better place.
Yeah, I could have been in the Bahamas by now. Yep, yeah. That's for sure.
But all the work that's been done, the innovations that have been done with COVID-19 and the apps, they're a good foundation for building up how to get patients to have their identity on hand.
Yeah, Alice, you're quite right. And even I think doing those things has encouraged us to think a little bit more ambitiously about what we can do in the future. James, I notice you have your hand up.
Yeah, thanks, Eddie, and thanks, Sue. Just a couple of comments. Just in terms of stakeholders, Sue, as I was looking at that diagram, and it's a good list and good breadth of people, I wonder were clinicians a bit underrepresented? Yes. I know they may have a role through the likes of HSEQI, but I guess there's a concern that there could be a concern that there becomes a sort of industry and a strategy around this that isn't really connected to folk delivering care, and that would be a really that wouldn't be the ideal balance of things. And the other question is maybe a little unfair, but it's about funding. And you might rightly say to me that you need a strategy written before you can develop funding streams, and you need to see what's coming and all the rest. But I mean, if there's likely to be resource behind this, that's great. If there isn't going to be resource behind this, you know, then that obviously won't take it very far at all. So that's a sort of a comment and a question. Thanks.
Yeah. We're going to get Sue to grow a money tree in the back garden. Like I suppose sometimes we need a little bit of money, you know, like lubricant money, just to try and help move things along. And I would totally agree, James, it'd be really helpful if we could identify more of that. When it comes to large scale money to enable, you know, massive rollout of particular initiatives, that's probably a different entity. That's where we need to be able to assemble cases that actually do make sense and get them through the traditional route approved and put in place. But
I think one of the things that we're going to try and do better is to join ourselves up with you know, organizations that are in the position to bring funding in, organize, you know, partnership with industry in a different way, perhaps. Maybe not funding, but maybe resources in different ways. So they are within the Academic Health and Science Network, for example. They've got good partnership with, for example, the associated body of pharmaceutical companies, where they allow, you know, resources to be brought in, skill set to be brought in that we don't have, but actually to allow them to bring project management skills, bring technology skills, bring data analytics skills, you know, things that we don't have. So we need to be very clear, even from a funding perspective, what are we actually looking to fund? Are we funding expertise? Are we funding development of a new thing? Are we funding actual time for people? So again, some of that, and once we break that down, we might actually be able to harness some of that partnership with the wider ecosystem to see whether we can bring that forward. And yes, some of the things with the city deal, they have lots of money, but we need to position health as an important partner within those funding bits, so that because they might have actually started without health, but now that we're aware of these things happening, we need to be there to kind of say, well, if you want to access health data, for example, you talk about it in your business case, where is the remuneration, or where is the time? Where is the remuneration of the time and the people to actually help you and to deliver to that agenda? So it's about having those conversations, really breaking it down, having those identify those opportunities, and slowly influencing the people who have the funding and the resources to include health and health of the population. And COVID has clearly demonstrated, in anything you do, if the health of the population isn't number one, I don't know what is.
Louise, you've got a hand up. Is that an old hand or a new hand?
It's a new hand.
Okay.
Yeah, just that thing we've kind of touched on it, that I think everybody, we're the public service, and we have to be very circumspect about engaging with the private sector in any shape or form. So all of this, it's important to just have that in mind. So in all of this, I think you have, I picked that up, but it means sometimes feel a bit reticent. I'm allowed to talk to these people. And yet at the early stage, I think James there, I think to some extent to date, traditionally, we've been a bit technology take, whereas we should be saying, here are my frustrations with my job, whether you're a, gastroenterologist or a nurse in ED, and say, anybody out there in that kind of world who has any solutions that might help make everybody's lives better and more efficient and safer and everything, turn that around. What tends to happen, or has happened in the past, a company or a sector has a product they want to sell to us, and I think that's, I think this is what innovation is about. Surely, here are our problems. It's a bit of push-pull, but I think it'd be useful to have that kind of facilitated.
Definitely. Again, so the reason for wanting to identify those key priorities as well is to encourage the partners to actually look into solving the problems that actually keep us awake, rather than come to us with their flashiest newest gadget and imagine that we will just jump at it. So yes, I think that kind of level of collaboration or discussion or conversation even, I think is really, really valuable. And I think, having spoken to some of the industry folks, they really want us, because they don't want to come to us and us telling them that's not something that actually we want to buy or commission from them. So that's a good point, Denise.
Okay, folks, we have another few minutes before we're due to finish this call. Are there any other points or comments that we would like to throw into the mixing pot?
Eddie, could I ask a question?
Hello, Declan.
Very, very quickly. Sue, look, I think that was a wonderful presentation in terms of trying to bring the whole innovation piece into some sort of structure. And I suppose from our perspective, Eddie, I want to pick up on the point that Catherine raised, and I think Louise also touched on it, which is buy-in from the health and social care workforce into the whole aspect of the need for digital innovation. And I think it's that point about how do we get that buy-in? I'm working closely with Claire around digital capability for social workers and social care workers. There's that aspect. I think we have to be better at selling what we do really well already in terms of innovation. And I'm wondering, is there any consideration for actually being able to almost sell that better? A lovely video at the very, very beginning, but there's lots of things that have happened in health already that if we could present that, not only to the staff, but also to patients, clients, providers out there, to suddenly give them the sense of, I need to be part of this if we're actually going to improve healthcare for citizens going forward, because we know digital has actually got the most value in terms of delivering better care in the future. I
think that's a really great point, Declan. And often so much of our comms is on the back foot, or it's in, I hope no one takes offense at this, rather stale press releases. And maybe we need to find different mediums for getting across some of those key messages that you've highlighted there. I'm going to move to bring this to a close only because we said we'd finish at 2 o'clock and it's now nearly on 2 o'clock. Marty Doyle, you had your hand up a minute or two ago and then lowered it. Are you looking to come in?
It was just around, you know, the business change element of any kind of innovation, and, you know, just sort of aligning that with the pace of innovation, because in the coming years there's a significant amount of change that's going to happen across HSC digitally. So it's just, that was one thing just to maybe mention, and the other thing was the downstream impacts of the innovation. So if it requires more coding and things like that, you know, we have a limited pool of coders and things like that. So you know, to sort of feed that into the funding element, it's not just, you know, the funding to get innovation to a certain point, it's the downstream impact of the change that innovation is going to bring about.
Thanks, Marty. Thank you.